I would like to definitely acknowledge and welcome the panelists who are with us and who have taken time to sit with us. And I would like to, first of all, give a very quick introduction to Abdullah. Do we have him? Can you confirm if we do have Abdulhamid Issa?
This session with
yes, I am on.
Okay.
Apologies, I'm on another panelist call here at the CPHI, but I'll be joining, and the connection is a bit patchy. So please pardon me if the connection goes off and on. But we're actually with David together trying to multitask across all of these presentation sessions. So I will be talking as Wendy as much as possible. Thank you.
Okay, no. Thank you, Abdulhamid. Thank you, welcome. So I just want to give a quick intro about who is Abdulhamid. So he's actually one of our hosts. He's from eHealth. He's an ICT custodian within eHealth, and so we've got the right person as well who's hosting us. He's leading as well that the development of the information management projects within eHealth, business applications within eHealth. So we are actually blessed to be having him participating, but also he comes with this very good background, appropriate and pertinent background, that he's the mathematician he is. He talks computer language, and he is within the business administration management sphere and pillar of everything. So he harnesses all that into making sure that we deliver, or in our sector, we deliver information management as is. And he is amongst us, and he is actually a product of our national university, Kano State, and in Nigeria specifically. So yes, he's one of the panelists. Heard him speaking. Then of course Dr. Lehman. Dr. Lehman, because you know him. For those who know him, Dr. Lehman, he is the head of the Atiku Institute for Development at UN Nigeria. He's normally here. He's also normally in Adamawa, and he is someone who has dabbled in all worlds, and he has harnessed that expertise, and he's imparting knowledge to our youngsters who are coming up in the academia. So as part of the academia, he represents the academia, the line of thought of academia linked to information management. He's doing a lot under part of the USAID funding through iMMAP, as well as the UN. And so I will not really take a lot of time, but we'll hear more about him. Then, of course, I'll move on to Suleiman, who is my colleague. He's actually leading the capacity building activities in the Bay region. He's very much involved in coming up with the investment in imparting knowledge to a lot of our interns and colleagues who are coming up the ladders in information management. He's someone who's well-versed with the development world, humanitarian world, and particularly the Bay region. If you allow, I'll move on to Yakubu. Was supposed to be here, but he's not in. Either way, I just want to ensure that you know why we invited Yakubu. Yakubu was going to represent the view and the vision of OCHA, the UN country team, and their investment and interest in information management investment in Nigeria. But we've got a colleague who's standing in for him. But it's important that everybody is aware of Yakubu. And also Yakubu chairs the Information Management Working Group, which is involved more in the humanitarian response and action in the Northeast. So he's a colleague that is there, and he's always coming up with innovative ideas in information management. I'll move on to Engineer Usman. So Engineer Usman, as much as a lot of colleagues here have not met him, but I think it's essential that most probably I dwell on him. He is coming from the National Information Technology and Development Agency, NITDA. And, you know, as when we look at the pillars of the government, pillars of the public sector, and the directorates that are essential in driving the narrative, the investment in the country on information management. So we do have the right person. As the National Information Technology, let's say the digital economy development specialist within NITIDA, he is going to be looking and working at most of the aspects, probably takeaways that we'll come up with, but also I think we're going to pick his brain and hear what he says with us. So it's important that we do have him sitting with us. Then lastly, of course, we have Emeka. Emeka is coming from the Ministry of Health. So we're talking to somebody who is the custodian of the digital health within the ministry, the proper line ministry that deals with health in the country, and particularly information management, digital health. It's a major area of investment, not only within the government, but with a lot of our donors. And he's representing also key and high-level officials who are supposed to be sitting with us, but either way, we'll give him space to ensure that we also understand the perspectives of the Ministry of Health. He is the Digital Health Desk Officer within the Department of Planning, Research and Statistics of the Federal Ministry of Health within the Secretariat. And of course, he's somebody who's digitalized. He's worked with a lot of healthcare systems within Nigeria, and yes, so he fits well with our narrative. And as we move on, I'll just like to welcome everybody, and I think we give ourselves a round of applause. What I would like to do to warm up our panelists is to throw in a question, very simple question to everyone else, and I'll definitely be highlighting who comes in just to give us a little bit of further intros and whatever other aspects I might have missed here. There's one question where we would like to ask each one of the panelists to say, if we are to look at information management in the country, its investment, how do you see us being effective in driving information management or digital health maturity, data maturity in the country, the investment? I would like to start with Engineer Usman. I think this will be an area of interest. If you can take maybe a minute just to respond to this and maybe introduce yourself as a proper title. I might have not said your proper title. Engineer Usman, over to you.
Thank you, Israel. Hello, everyone. My name is Usman Maruf Yakubu. I am the lead for digital health in the National Information Technology Development Agency, NITA. Regarding your question around the role of information management and digital health in the context of overall development, I'd like to say that Nigeria being a country classified as a least developed country or low middle income country, human capital is very essential. And to do human capital, one of the key components is, of course, life expectancy, which leads us into digital health. So information management in the context of digital health or healthcare domain is very important because it's a science of information and information management and insights and knowledge. So as much as possible, the several layers from national level public health to the patient, you have a torrent of information that needs to be categorized, organized, synthesized, and understood in order to make more informed decisions, to make better policies, to come up with new medications, new drugs, new therapies. But we are seeing a very, very increased interest and convergence between the various actors. A couple of years ago, when we started this journey about 15 years ago, the landscape was much different. But now people are coming together. There's much more interest. There's a lot of work going in. And what we just need is more collaboration. Thank you.
Right. Thank you, Engineer Osman. Yeah, it was just to warm you up. We'll still come back to you on this one, but very much appreciated. I also would like to move on to Dr. Lehman. If you can talk on the same point of how do you see that effective information management contribution to better decision-making process investment within our economy. Over to you, Dr. Lehman.
Thank you very much, and good afternoon, colleagues. Like Dr. Abdulhamid said, I mean, we will come at it from an educational institution. Of course, the world is going towards digital information management, particularly in the health sector and education sector. And I think in the context of Nigeria, what we kind of challenge with is not the knowledge or the skills, I think is the usage. And the usage is related to hardware and software, but also related to cost of connectivity in terms of internet. Thankfully now, there are so many options in terms of what you can do with access online. So even if you don't get the digital connection from the service providers, telecom service providers, you now have access to direct satellite connection with Starlink and others coming on board. So I think the sky is getting clearer, the access is getting wider, and certainly the usage is actually increasing more and more as the users and the countries and the ministries and departments realize the importance of data. They have no choice than to reach out. So what we need to do, both users and suppliers and institutes like NICTA and ourselves, is to make sure we have credible data, good high quality data that can inform users who use it so that they make objective decisions that are impactful. Thank you, and over.
Thank you, Dr. Lehman. Thank you very much. I would like to move on to Suleiman. So Suleiman, same question, but with you specifically because you're in the Bay region, how do you see effective information management contribution to better decision making, particularly when you look at humanitarian response, life-saving response within the Bay region? Can you talk to that very briefly? To you, Suleiman.
Thank you, Israel, and good afternoon, everyone. In the Bay region, where mostly the humanitarian partners play all their roles, and I think almost everything is guided by information management, because before any humanitarian intervention takes place, they are being planned, and the plan happens by getting to know the number of beneficiaries or the number of affected population, the locations where the affected population currently stay or at the time of intervention, and the reason why the population left their location if there is a displacement. So all this happen and are guided with data. So without data, no humanitarian intervention can effectively take place. So I think data or information management plays a key role in this. And yeah, mostly I just say this briefly because you say briefly, but the data gathering activity happens to conducting the need assessment, secondary data review to understand the situation and get the right picture. Thank you.
Thank you, Suleiman. Thank you. It's definitely, we've got limited time, but this is quite useful. Then I would like to move on to Emeka. So Emeka, maybe if you can talk to this, to the same point in relationship to how you see the overall investment within the Ministry of Health, within that particular sector of the country. Over to you, Emeka.
Hello, Israel, and good afternoon, everyone. It's nice to meet you all in this webinar. My name is Emeka Wanko. I'm the Digital Health Desk Officer at the Department of Planning, Research and Statistics in the Ministry of Health. Yeah, so basically, health information has been, or has always been, a foundational component of healthcare. So if you look at the WHO building blocks of health building blocks, right, you will see that health information, among other things, we have healthcare financing, we have medical technologies and all of that. But health information is a component of the health building block. This tells us that much investment is needed to optimize information for us to achieve healthcare. Then if you bring it down home, bring it down to Nigeria, you discover that health information management, not just health information, but health information management, including the management systems and everything that has to do with health information management, has been highlighted as a priority area for health in the National Strategic Health Development Plan. So this is a component factor. Health information management is a component factor for us as a country to attain our universal health coverage goal by 2030. So investment from the Ministry of Health perspective has to be directed towards optimizing and ensuring that we have an effective health information system for us to achieve that strategic development plan for health in Nigeria. So that's just a brief summary.
Thank you, eMMAP. Thank you for being brief on this. And Issa, if you can help me, we've got a colleague who's standing in for Yakubu. I just lost the name one more time. Would like to give Ocha the opportunity. Colleague from OCHA, please can you come in, standing in for Yakubu, and talk more on how the UN country team sees information management as a building block to interventions and development of Nigeria. Is this something that you see as we can hear from you just a minute on this briefly high level?
Thank you so much, Israel. Good afternoon, everyone. As I said, my name is Faisal, and I'm representing the head of information management unit here in OCHA, Mr. Yakubu, who is on another mission. Just to talk about the effectiveness of information management, as you ask, with regards to development in the humanitarian context. I can tell you that information and data, it's almost everything with regards to ensuring that the affected population are being reached. If you look at all the sectors, the health sector, the education sector, they all rely on the data and the information to ensure that whatever intervention they are going to give in all the humanitarian community, to ensure that they are reaching the right people. So we need this information and the data to ensure that we are really coordinating all the sectors to come together. And also we use that information to advocate in terms of what funds we need and what services we need to render to those affected population. And also we use those information to gather the funds. And also they are also being used to inform the sectors of what needs they need to address in terms of those locations. So just to round it up, I can say the role of OCHA is just to coordinate in terms of to coordinate all the sectors to ensure that what is needed is what is being done in terms of reaching the affected population. So as OCHA, we also ensure that all information managers are brought together through the IMWG and also other forums of the information management section, and also develop all the policies to ensure that all information management and data in terms of sharing, in terms of the quality of the data, have been ensured through those forums. So just to summarize, this is what I can say with regards to your question. Over.
Thank you, Faisal. Thank you. So everyone, I think, is warmed up on this. I'll just do a quick check, really quick check on everything that has been said. That has been said by everyone. You know, for effective, what I hear is we're saying effective information management requires human resources, requires investment in that, connectivity, internet penetration. What I talked about earlier on, credible data, maturity, existence of data, the maturity of that data. Then, of course, colleague from Ministry of Health talked about universal coverage, impact of information management to the achievement of universal health coverage. Key aspect for them. Then, of course, when we listen to our colleague from OCHA, we talk of better targeting, better coordination, better information to allocate for allocation of resources, funding, engagement of everybody in the provision of services, particularly in the emergency setup in the Bay region. So it's everything about everything, but we really need to make sure that all this comes together, gels together, so we've got effective information management. Now, I'll quickly go into very key and specific questions directed to our panelists. I'll start again with Engineer Engineer Usman. The question that we would like you to share with us and everybody else who's listening in is Nigeria over the last few years, and particularly the last few months, has been coming up with an information management regulatory framework, a lot of other guidance tools that are already in place. I was lucky enough to participate in one meeting that was chaired by the NIF, where we were taken through the regulatory frameworks. It's very important. What is your take and your opinion in the evolution of regulatory frameworks in Nigeria, and for the benefit of everybody, particularly focusing on the health pillar that we're talking about and information evolution within Nigeria? Over to you, Engineer Usman.
Thank you. Thank you very much. So as you asked, so regarding information management at the national level, Nigeria has evolved steadily from, the key reforms from 2000s around telecommunications. So this has enabled really a new sector to come up. We can see the steady contribution of the ICT sector, which is a key part of the information management sector, to the GDP. We've seen trends and increases in internet penetration. We've seen a cultural shift and a very key understanding of the role of information. Within the sector of the ICT sector, we've had a lot of policies and regulations that have come up. We have the data protection regulation that was recently the Data Protection Act. We also have other existing policies around cloud, around the data strategy, around cybersecurity, and the rest. So overall, we're having a very, very significant shift in the role of information management tools, information management technologies, and the role of information management. People really want to know what is happening, why is it happening, who's doing what, to what extent, and even an increase in evolution of how people think about it. Now they want to know the outcomes. They want to know the outcomes of certain actions in the public and private sectors. So information has become very key to everything as a whole, and the evolution of the frameworks, the legal frameworks, the regulatory frameworks has been on a very, very steady rise. We've seen in digital health since the launch of the eHealth strategy in 2015, we've seen significant improvements, including the adoption of standards for information management regarding the ISO standards. We've seen adoption of other standards in other sectors as well. Key to that is also the digital economy policy. We've seen evolution in fintech, and all this is conversing to kind of enable, as we said, universal health coverage as a whole. For us, we've been keenly supporting the efforts through the various work groups that we serve together with eMMAP and the other teams. And what I would say going forward is the need, as I said again, the need for more collaboration, the need for us to reach out to more people, the need to be discovered and discover more people and more pockets of value and to collaborate forward in terms of the evolution, taking up a more inclusive, stakeholder-involved approach. This, I think, in my opinion, is the way forward. We cannot underestimate the power of the academia in this by arming young people and startups with the knowledge of these regulatory frameworks so that what they build can scale, can support UHC within Nigeria as well as across the continent and other LMICs. Thank you.
Thank you, Engineer. Please hold on there. Just a quick question. Are there already documents, regulatory documents, ready for sharing with the humanitarian world, with the development world, with the UN, with your stakeholders that are readily available, and what platforms exist, what links exist so they can easily access such documents? Over to you, Doctor, Engineer.
Thank you very much. So for, yes, there are links. I would share the link in the chat and the list of the standards. So for one, as I mentioned, we have 32 ISO adopted and adapted standards. They are already now Nigerian industrial standards that we expect players in the market, humanitarian, private sector, and government alike, to adopt and also have them within their systems. These include standards ranging across from information security, telemedicine, and other related services, including like clinical document architecture and the rest. So I would share that. We have the National Data Strategy, which seeks to kind of position how Nigeria will utilize data to power its development objectives. We also have the cloud policy, the National Cloud Policy, which seeks to kind of push the cloud-first adoption approach in order to leverage this technology to bring down the cost and kind of make it improve accessibility to IT resources as a result of taking a cloud-first approach. So overall, this is also with inclusion to the work we are doing on the enterprise architecture to support, the alignment of the business of government with, the business of government and IT, and how IT systems can support the missions of the key government agencies in terms of delivery. We have the Nigerian Government Enterprise Architecture Framework. We have the Nigerian e-government interoperability framework, and we have also a standard for data interoperability. These are all on our website, so I would drop the link in the chat for everyone to get a piece at. But what we would do continue going forward is to work with the ministry through the already existing governance structure, which Emeka and I are part of, as well as other people, and to encourage our partners to also join the various work groups and to support the work in that, so that we can take a more national and sub-national approach to kind of push the standards into mainstream adoption, and have the necessary post-adoption surveillance needed to kind of refine and improve and how people understand it, because we're dealing with two separate domains. One side is the technology side, one side is the clinical or the healthcare side. And in the healthcare side is various layers and various actors all looking at different things and all targeting different things. So it's very important that we kind of identify all of them and see how to support them with the various needs that they have, as well as taking up a more public good, digital public infrastructure approach to the development of these, so that we have more reuse, modularity, and bringing down the cost as much as we can. Thank you very much.
Thank you, Engineer. Please hold on there. We still want you to stay in your seat. This is a different set of questions, and I'll kindly ask our colleagues from eHealth at some point to see if maybe you are given a platform to answer, maybe written or in the chat. But my questions or comments, the first one is the linkage which you talked last on, linkage with the Minister of Health. Minister of Health, let's say this from a layman perspective, Minister of Health are the drivers or the custodian of the delivery of the health services to the common person on the street. And we have got the digital or the information management regulatory framework emanating from the Ministry of communication and digital economy. How do you align and link, given that most probably the Ministry of Health is looking at the actual delivery of services, and maybe you are looking at other sectors, and that dialogue, I think, is important, because quite a lot of people who are listening in this webinar, they come from the NGO world, linking more with the Ministry of Health. They've not engaged, frankly, in detail and deeper with the Ministry of Communication, or your department as well. And another point and comment here is compliance. In the last meeting that I participated in, there was discussion on compliance, and there was going to be enforcement on compliance requirements. And so our colleagues who are sitting here, although they are not strategic leaders, but it's important that they are fully conversant and they know the compliance aspects related to the drive towards the regulatory framework as well. So this is something that we might want to hear at some point. Then lastly, it is now that you are, I understand you arrived in the Northeast, there's the humanitarian world and their colleagues who are there. Maybe that interaction, stakeholder interaction, yes, we know maybe you've got your mission, but it's also a kind of request that at some point we do have all these colleagues driving the same narrative that you are interested in, but I think the synergies need to be there. Maybe reaching out and making them aware. I've got colleagues from iMMAP here, from OCHA, listening in as well. If you have some time, I think it will be very interesting for them to understand where you are coming from and where we're going to as a country. You want to maybe give a word to that, a very short word, before we shift on to the next panelist, Engineer Osman?
Yes. Yes, thank you very much. So I'm here in Maiduguri for the next 8 days. So we can have a chat with the teams here around the existing regulatory frameworks and our approach and what we have on ground and the partnerships, possible partnerships going forward. I'm very much open to that. Regarding the compliance mechanisms, so digital health sits at the nexus between tech and healthcare. So when you look at issues like, for example, one of the major issues around digital health is privacy. So already there were, when in the paper-based format, there were already existing laws and regulations regarding that. But when it's in digital form, the need for security is tenfold or 100-fold, because with one flash drive, you can take the records of an entire population. So regarding that, the need for cybersecurity is very, very much more severe in case of digital health. And for that, we have supported the work around the cybersecurity, the national cybersecurity strategy, as well as ongoing work around the public key infrastructure to kind of strengthen that regard. So we expect that supporting the Ministry of Health and through the interministerial governance structure led by the Minister of Health with the co-chair, the Minister of Communication, we would have closer collaboration to kind of bridge that gap between the clinical side, the healthcare sector, and the technology people, so that the technology people supply the right tools in the right context with the right regulatory views to the healthcare domain, and as well as kind of looking around the human capacity and human capital for the people in the demand side of things, the decision makers on the healthcare side, to understand these technologies and to understand the role that they can play in really easing up and improving access, removing barriers to distance, improving the scale, the accessibility, lowering the cost, improving significantly safety in that regard. So I'll be very much happy to share with everyone here. I've been very much passionate about this for the last 15 years. It's a really key, it's a very key passion for me. And we will continue the work. What I would encourage our partners to do, and people listening in on the call, is to kind of reach out to the focal people, Emeka at the ministry, to kind of bring us all on board and join the various groups and seek to support these various technical working groups that are being re-energized now under the new leadership at the ministry to kind of put it all together. We want to bridge that gap between the public, the private, the academia, and the regulatory agencies to kind of put it so that the patient, the people, the displaced persons, the people in conflict-afflicted areas can have much more expedited access to healthcare, and major populations, including emerging issues around NCDs. So as I said, I'm here in Borno for 8 days. The team from eHealth can reach me. For anybody interested in kind of having a chat, we can have a sit down. Thank you very much. I would share also the list of the standards on the chat for people to be aware of, as well as the nature regulatory frameworks around healthcare. Thank you.
Thank you, Engineer. This is very useful. So I just want to encourage colleagues from NIF, OCHA, iMMAP, NGOs in Born, those who are listening in, please reach out to him, and let's make the best use of his time whilst he's on mission in the region. That's the only way we can benefit as well. Besides really that he's acknowledging for us to deliver in all what we do, then we need to harness information management. We are in the country as well, which has got rules, regulations, compliance issues that we have to abide with. And there's a level of quality that we need to also engage with ourselves as much as we try to deliver what we're delivering. And the best use of the donor monies and the population within the country. So yes, please take advantages there, and let's engage in as much as possible. I'll move on to Suleiman. Also, I'm just looking at the time here. We've got very limited time, but colleagues, if you can, as much as possible, consolidate your answers, but try and be extensive as much as you can as well. So Suleiman from iMMAP, we know you're working and building capacities in the Bay region. Can you talk to how can information management systems be designed to support the needs, the different needs of our different stakeholders in the humanitarian action, maybe even the donors and colleagues who are working out in the field? Can you talk to that? Over to you, Suleiman.
Thank you, Israel. To say that, I want to start by saying generally, information management systems play a crucial role in supporting humanitarian stakeholders as they help in handling information in complex and dynamic environments like the humanitarian situation. And designing such systems involves addressing the diverse needs of various stakeholders involved in humanitarian activities. These stakeholders may include government agencies, non-governmental organizations, national and international, local communities, UN agencies, and even the donors. And now speaking about how information systems should be designed to support this kind of dynamic situation, I would like to first of all point out some key areas of consideration when introducing an information system, which is having of which is inevitable. Part of these considerations, I think, will be the first thing is understanding the concept, the context, by conducting a requirement gathering through data assessment or experience gathered through some time spent operating in the environment, and feedback from the humanitarian partners. Then these kind of systems have to be flexible and to be able to accept customization as the emergency or humanitarian situations is always very dynamic. It doesn't stay the same all the time. And apart from that, even the users of these systems, maybe humanitarian partners, may have different need to achieve on the system, or maybe they have different programs. So there may not be like one design for all, and the system should be able to interoperate because they are usually smaller systems employed by different organizations. So if there is one system that is able to interoperate with different other systems or different data sets around, which can be a one-stop of information, is very key. And another thing is localization. We can have the best system in place, but if it is not designed to suit the local needs, it is not really going to be feasible. And in its humanitarian information systems, information management systems, there should be room for collaboration and coordination with different partners. And this kind of system should also be able to guide partners or whoever is using it with geospatial imagery or geospatial analysis, because some locations may have people sitting there and are not physically accessible. So this kind of system will help if they're in place in determining the coverage area of a certain population sitting or in infrastructures sitting at certain places, and they will really help in making decisions. And in this effort, iMMAP Nigeria as an organization has already taken.
Suleiman, please, if you can do it in the next 2 minutes, I would definitely appreciate where we've got time constraints.
Oh, okay. Thank you, Israel. Okay, so I just want to say iMMAP has taken a giant step in this regard by launching 2 different information systems last month. And these are, we have a learning management system that support our capacity building reach. We normally reach people physically through the capacity building. The numbers are limited. And now the information system is accessible to all. And some people are already taking courses. We have almost 400 participants currently running one course. There is also another system introduced to support humanitarian decision making.
Suleiman, is it possible then to put some of these aspects in the chat? Please, if you can write and put them in the chat, I would definitely appreciate. Okay. Or wrap up and the points that you're not going to be able to talk to, please put them in the chat.
Okay, Israel. Thank you.
You can wrap up, Suleiman.
Okay. Okay. So finally, the SDSP Special Decision Support Platform, iMMAP has made it available to, with no iMMAP data, but using open source data that iMMAP considers very vital in supporting humanitarian partners. These data sets are from STX, Grid3, OSM, and Living Atlas, and other sources. And the platform has a special feature that allows whoever is using it to see a lot of things, to make a decision. We have
thank you, Suleiman. Suleiman, thank you. So I would like to thank you, Suleiman. Please put everything in the chat. I would like to call upon Abdulhamid. He was, I jumped him. I acknowledge him. He's standing in for David. Abdulhamid, if you can hear me, please go ahead before I move on to Dr. Lehman. Abdulhamid, please, over to you. Abid? Okay, so Issa, I'll kindly request to see if you can reach out to him and work around that. Dr. Lehman, I would like to move on to Dr. Lehman, who is representing the academia. So for Dr. Lehman, the question is very specific in the sense that with the academia, we've got the stream that creates the human resources that come up to fill the gaps that are created or that are there. And as you look at our information management ecosystem, what are the existing gaps that currently hinder the optimization of health information management systems in Nigeria, in our context, specifically in our context? Can you link that to to the essence of academia in information management evolution and ecosystem in Nigeria? Over to you, Dr. Lima.
Thank you very much, Israel. It's a great question. Part of what we see in academia is and this is everywhere, not just Nigeria, but there's a huge gap between specify health information management system developers or producers such as eHealth and NICDA, as well as academia that trains the human resource for that. And that gap becomes noticeable when you have new graduates joining development agencies or ministries of health, where data suddenly has to be used, analyzed, and used for that purpose. So we in academia, of course, will train with the theories and practices for information management system. And most times, not all the time, but many times we are behind with current software and skills that are required in that arena. So we tend to train maybe, I'll use an estimate, maybe 3 years, even 5 years behind, so that when our students come out, the technology has gone far, far, far ahead and they are really behind. And until there's a conscious effort to bridge that gap, then you end up always having new human resource personnel that are coming in on stream that cannot and will not be able to advise, use, and impact on health information system because they just don't have the right skills. So they take some time on the job to learn it. Now, what we are seeing with federal agencies like NICDA, which has the corporate responsibility or national responsibility to ensure that all of these softwares and others are vetted before they're allowed, there needs to be either a forum or a sharing avenue where the universities and other polytechnics that do this training are aware of current trends in information management. I think that will help in addressing that. I talked about the access issue. The access remains an issue. Many universities do not have the resources to go online or remain online significantly, but as individual students do have on their mobile phones, and many of these resources are actually easily accessible on mobile. So I think it's the disconnect between the trainers and as well as users of the information. As we begin to bridge that gap, we begin to see a change in terms of both use of the data and also impact in terms of reducing health challenges that we have as a country. Thank you. Over.
Thank you, Dr. Lehman. Just hold on a little bit. Can you talk to the trends, investment trends in the academia vis-a-vis the requirements, the needs of the country, and catching up with the evolution in information management? Is the academia in the country catching up? And when you look at digital health, are we catching up? Are you happy with what's there? If you can talk to that. Over to you, Dr. Lehman.
No. Well, certainly, I mean, we're all Nigerians and many others. So this is the reality. We are not catching up. We're really way behind. If you say catching up for training manpower for projects, for example, yes, we are catching up because when they get to projects, they suddenly get opportunities to develop as in-service opportunities arise. But in general, we are not catching up. And there has to be a deliberate government policy. And I know there are attempts to do that, particularly with agencies like the NICDA itself that is right in the middle of all this. But we're not catching up, particularly for public universities. They don't have the investment to get the necessary equipment and even lecturers of that quality to handle that. So you end up having the good quality in private universities that cannot cover much of the enrollment requirements, and therefore there has to be a deliberate effort to make sure that we bridge the gap for public universities to get that access to current trends in information management. Thank you.
Thank you, Dr. Liman. Then last question, then we move on to the next person. Last time I had interaction with you, I think you alluded to an introduction, or you were looking at public health qualification introduction. Can you talk to that a little bit?
So we just got NUC approval for the nursing component of that, but the program we're talking about is not the traditional MPH. It's MPH tailored towards more focus on use of data to inform, to advise and inform practice. So that MPH is still under design, and we are getting a lot of interest from global universities that are interested even to take part in that program when we finally get NUC approval. That program will allow Cambridge, for example, Oxford and Columbia universities to have students in their respective places and in Africa, and then together they brainstorm on large data set issues with large health data sets that they can work on and see how that. You see, when this COVID came up, we suddenly realized the importance of epidemic data, large scale epidemic data that we hadn't focused on. So that MPH is slightly different from the traditional one. And yes, we're excited to focus on MPH on large data set management for health systems in Nigeria. And we believe that we should get approval anytime from now from NUC. Thank you.
Thank you, Dr. Liman. Thank you very much. This is quite insightful. I would like to go back to Isa. Isa, can you confirm if Abdul Rahman is available?
I think he's having network challenges, so I'll reach out to him.
Do you have anyone who can say something on his behalf? Well, I'll shift on to Emeka whilst maybe you touch base with internal colleagues. As soon as Emeka is finished, then I'll come back to you, Isa. Emeka, now I would like to shift to Emeka from the Ministry of Health. Emeka is, fortunately, is the custodian of the digital health issues that we're talking about here. He's a practitioner, so to speak. So Emeka, the question is, what are the emerging innovations that give opportunities to the information management sphere ecosystem that we're talking about here for the stakeholders, for activity implementation, what we should look out for, what we should explore, and what are the prospects really of moving forward, data maturity. You heard what other colleagues talked about. Then, of course, to wrap it up, what are the prospects of health information management, and that, the easiness of shifting from one platform to the next, one system to the next within the country and getting everything moving. You will call it simply as that interoperability, but I would like to simplify it to that easiness of shifting and getting things moving. And the challenges that we have in the health sector. Can you talk about it, Isa? I think we've got 5 minutes for you on this. Emeka, please go ahead.
All right, thank you so much, Israel. I would start with the first question that talks about the emerging trend. So I'm happy that Engineer Usman has been able to give an elaborate talk on that. So he was able to touch some of these points, and he was able to, spell them out. So I'll just build on what he has said, right? So, of course, in terms of the emerging trend, there was something he mentioned about public goods, right? So we as much as we want to see people, develop local content for information management, there's local data systems for managing information. We also encourage the use of public goods, and we see this as an opportunity. We see the opportunities there, especially for open source softwares, because there's been like a community that has been built around these open source systems, and then we understand that these communities are growing, and then there's been this support that these softwares receive and all of that. So we believe believe that this is one of the opportunities that can be leveraged or that can be explored by stakeholders within that ecosystem. Before I drive further on some other points, I want to make a statement here to say digital health ecosystem should be viewed as a value chain, right? I mean, when we look at the agricultural value chain, we look at value chain in other sectors. When it comes to digital health, it is good we view it from the standpoint of a value chain, right? From the point of data production to data storage and data use for action. This value points, this individual points, there are value that can be accrued, that can be harnessed from these points, from data protection, from data storage, and from data use for action, right? So when we begin to see it as a value chain, we begin to think of how we can, reap benefits from it, how we can invest in it, how we can, grow it, and how it can become profitable, for the system, the entire healthcare system in our own case. So I've talked about the open source softwares and public goods. Then, of course, the further opportunities we see, and I think this is where we can work more with the academia, people like Dr. Liman. We see an opportunity in terms of standard and interoperability labs, because we think that when we have a strengthened standards and interoperability laboratories, we can test our ideas. Right, so we have the academia. The academia is, coming up with theories. We have our NGOs that feels that, oh, they have a perfect system that they think could work and all of that. So we have people building connectors, people building translators, people building softwares. So, but what these standards and interoperability laboratories help us do is to, give us that sandbox where we can test, where we can test run things and just play around with things and see how they work, so that we can, before we start talking about scaling up on a larger, taking up on a larger scale. So these are emerging trends, emerging opportunities, because this is how we have seen it work. Other places we see a kind of a collaboration between the private sector, the public sector, and then the academia. Very important to build this kind of system where ideas can be test run and all of that. Then, of course, there are opportunities in big data analytics, like Dr. Liman has said. So we have seen we have seen how data is being harnessed for the future, and we understand that health data, if we are not at the forefront, we will be met with a situation where we are late on the utilization of health data and its use for decision making. So let me just give a quick example. When in the financial sector, everybody knows what happened in the financial sector, where blockchain came up, and then there was this proliferation of cryptocurrencies, and then the financial sector was late to catch up with the technology and all of that. So if we don't move early in the health sector, we're going to have that situation out of hand, where we have, the use of technologies and tools to generate health or to manage health data, and then we are grappling on how to maybe control or how to harness or how to coordinate all of this. So we need to start talking about how do we coordinate the use of big data? How do we coordinate the translation of this big data to inform action, to inform policy that could improve population health outcome? So we need to be talking about all of that. Then these are just the basic things on the emerging trends and opportunities. Then for our priorities, I think you asked a question about what are I think you said something about priorities. So in terms of governance, okay, what we are looking at, because like Dr. Engineer Usman had said, we had already inaugurated a digital health technical committee, and we understand that the problem of health information management in Nigeria is not so much of a technical problem, right? It's not so much of a problem of lack of solutions or lack of tools or the technology. It's more of a problem of coordination, right? The problem is more bureaucratic than technocratic. It's more of a bureaucratic than a technocratic problem, right? So we understand the importance of this coordination. Engineer Usman kept saying everybody has to come on board. There needs to be more collaboration and all of that. So we have taken that that first step to say, let us have a technical committee, let us have a governance structure. And then it's in line with, of course, it's in line with the Ministry of Health and Digital Health Strategy and Digital Health Policy. So we're looking at an all-encompassing governance structure that would ensure that we are able to decide how we want health data or health information, so to say, to be managed. We are able to decide how we want this data to be shared. Because I mean, that's one point you keep hitting on. How are we able to move data? I noticed you avoided using the word interoperability because sometimes it could be misconceived. Yeah. So, but talking about interoperability, if we have a governance structure, the governance structure gets to decide how we can make data systems interoperable, and then what tools are available and what standards do we need to meet up with and all of that. So we have taken that first step to say, okay, let us inaugurate a committee. Let us get people on board. Let us widen the range of stakeholders and bring as much stakeholders as we can to chart the way forward to help us build an ideal and an interoperable system, ecosystem for health information, right? So I'm still on that point. Of course, we also
Emeka, I've been given additional 2 minutes, not beyond that. Okay. If you can package everything, so it's and I can see with Francisca, she's been having her hand up, but please pack it up so we can maybe wrap up as well.
Okay, so I'll just wrap it up with what Engineer Usman said about agencies and government ministries, departments, and agencies coming together to build an enterprise architecture that could, support the e-government vision of Nigeria. So, for us, we believe if we're able to design an effective enterprise architecture for health information, then we can pinpoint this this bottlenecks, and then we can decide how we want this architecture to be designed, so to say, such that information can be exchanged, information can be harnessed for decision making, and such that information can be secured and made. Of course, data security is a key component of information management. So, enterprise architecture will, can only be achieved for health when we are able to have that collaboration. Right. So I'll just drop it here.
Thank you very much, Emeka. I would like to honor Francisca. Francisca, I see your hand is up. Isa, can I take Francisca's question? Isa, are you there?
Yes, I'm here.
Yes, can you give Francisca Wakori the platform to ask a question? We've got some questions, but I think we're running out of time.
I'm so sorry. Thank you so much, sir, for this. My question is actually concerning bioinformatics and all the genomic data we are generating in this country that is being uploaded in other people's information system. Is there any way, maybe from academia angle, where you have a plan on how those information can be for Nigeria, secure for Nigeria, and used for Nigerians to promote health? Thank you.
Excellent question. Emeka, take this one up immediately. Emeka, please, as brief as you can.
Right. When you say other people, I think we'll need to get more context about the question. When you say other people, who are these other people you're referring to? Are you referring to development partners within the country, or are you referring to private businesses that come into the country, take health data and store outside of the country? Can we just get a bit of clarity on the question?
Can you talk to the two options? Can you talk to those two, Emeka, please?
Okay. So of course we understand that development partners implement projects and in health, including bioinformatics projects, and data are being generated, and these data are sometimes stored outside of the approved systems and all of that. But like Engineer Usman had said, we have a Data Protection Act. We have regulatory frameworks. The fact that we are low on implementation does not mean that there are no there has been an oversight in that area. No, so there is actually regulation around these things. For instance, we are not allowed to store population health data outside of the country. These are things that you get to understand when you probably go through our Data Protection Act and all other regulatory framework that Engineer Usman had shared with us. So we would have to probably collaborate more on seeing how we can enforce implementation, because there are guidelines. There are guidelines. So we should talk more of how we can enforce those implementations of those guidelines to ensure that the private sector, whether it's private sector, whether it's development organizations, they are aware of how this health data should be used and how it should be stored, how and where this health data should be stored. So I think I'll just allow Engineer Usman to jump on it.
Yeah, hold on, Emeka.
All right.
Also, Divine is asking about sharing of the SOP for health information system. Do you have anything to that effect?
All right. So we have an SOP. We have an SOP for health information exchange, and then we have the NHMI's. Of course, we have like a guideline for NHMI. So what will happen is I do not have a link like Engineer Usman, but I can always get these documents and share the document. But I mean, that's part of what we are looking forward to having, like a one-stop shop where we have all these resources put together so everyone can just go and see everything. Perfect. So I think by early first quarter next year, we should have that.
Perfect. Thank you. Thank you. Dr. Lehman, I think anything that you might want to chip in? I think we're overshooting the time that's allocated, but I would rather give Dr. Lehman. Dr. Lehman? Okay, Dr. Lehman might not be there. And Engineer Osman, is he here? Engineer Osman? That particular question from Francisca.
Yes, thank you very much. Regarding, so when data is collected about a person, including healthcare, it's actually under the purview of the Nigerian Data Protection Regulation. So when you're collecting that data, and that data has to be given with consent, informed consent, in line with you can take a look at the regulations around that. So when that data is now available, it depends whether the person consented to be part of that. Now, if it has to do with healthcare and not just, then there are of course certain ethical guidelines and procedures that are in place. So, for example, if it's in a teaching hospital that the information is collected, there are ethical boards, I think, that have to give approval for those actions to happen. So it depends on what institution is collecting that data. So you cannot stop a person, for example, for joining a study voluntarily in another country if he gives consent to join that study as a Nigerian person, as a natural person of Nigeria. So it depends on the context, but we are sure that if you collect data for clinical trials, there are guidelines around that. If you collect data about people, natural persons in Nigeria, we have the data protection regulations around that. So these are the two that we rely upon currently, and other existing regulations in the digital health domain. So about the data being hosted outside, we have the data strategy that points to, gives guidance on that, and the cloud strategy as well. And as Emeka said, you cannot host population data outside the country because, of course, it's the critical sensitive nature of it. So with that, I would say is to look at those documents and see, and furthermore, we could kind of try to have one place where all the questions can be there for people to ask. Thank you very much.
Thank you, Dr. Usman. This is very useful. Now we're left with two panelists, but also the time that we were allocated, we've gone beyond that, and I can also see Dr. Dominic his hand is. Unfortunately, I can't go beyond. Dr. Dominic, I think you can write the question in the chat, but I also want to invite Faisal from OCHA to talk to the question that we've allocated to you, so that at least colleagues can get the answer in the question. We've got a set of questions for the panelists that we haven't gone through. We would like to send them, and also we've got the registration information from those who have participated, who will keep you looped in and on everything that's happening. And so unfortunately, I have to wrap up. However, before I even go beyond to close everything, I just want to raise one or two aspects, really. So as you can see, this is really an interesting pillar of for us to discuss. So meaning, besides the information management working group, which is specifically headed by OCHA for the Bay region, we've got so much happening in the country. I personally would like to encourage everybody who's sitting in here to have that information management nexus, meaning we are all technical people, we talk different languages, but at the end of the day, we come to the same table. We've got technical experts here, we've got non-technical experts, health people. Please, I think Nigeria deserves more, and we are there, and I can see we don't talk a lot. So I want to encourage that with such platforms, let's talk. And also, I want to let you know that at the peak of this webinar, we reached 99 people. So there were more people from different sectors. So it's not only us who are talking, with more colleagues from different areas and different backgrounds. So this is going beyond, but let's not lose hope that I think we need to continue talking. And eHealth, with the different iterations of these webinars, I think they're doing a good job. But colleagues need to come to the table, because also they need the ideas so that we can come up with something like this. It's unfortunate that Abdul Hamid could not join because he's somewhere else. But I think the next opportunity that he has, including Dev, I think we should be able to have strides ahead. And for those who are in Borno, Dr. Usman, we look forward to successful engagement with colleagues in the north. I just really want to wish everybody success in what we do, and I'll share most of the questions. I will share most of the questions, so at least we can move forward. And of course, colleagues, we do have the information being shared on your screen. Scan, download the app, download as well the webinar. There will be more information, and colleagues will receive additional information. I'll stop there and pass on the mic to Issa. Issa, can you take the mic from me? Over.
Okay, thank you very much. It's been a very interesting time. Unfortunately, we actually overshot our time, but then I know it's all worth it. We do appreciate all the panelists and Israel. You've done a very fantastic job. I expected you to wrap it up from here. From here, thank you very much from everyone at eHealth Africa. We do appreciate all the panelists and all the participants. Again, thank you very much, and join us next time.
Thank you very much. Good job.
Thank you. Yeah.